So today I wanted to just give a brief overview on what ICAP programs are. And for those of you who may know about the programs and those who might not, an ICAP program is called an Intensive Comprehensive Aphasia Program. And I was not aware of these programs until I have been extensively researching aphasia programs for my mother-in-law. And so, and as we know, aphasia is a disorder that not only affects the patient, but the entire family communication and the entire family unit. And this is such a devastating disease for the patient and caregivers. And so I wanted to kind of give you a brief overview of what I found. And now this is a disclaimer, it's not an extensive list of things that are out there, but just kind of a generalized idea that we can go from here. And as we know and find out more, we can add. And so the aphasia programs, the requirements, you have to have at least 30 hours of aphasia targeted therapy for a 2-week period for these patients, and that tends to work out to be about 15 hours a week. The other requirements that it includes resources for the caregiver and family education that may be in a supportive group setting or one-on-one. Also, these programs utilize a variety of services. So within their program style. So they have to require individualized sessions of therapy for the individual, which are these intensive periods of therapy. But they also have group setting for the patients and group settings for caregivers, and some of them are combined and some of those are separated. And they often utilize technology or an advanced software to increase communication methods. Some ICAP programs that I've heard of offer their own type of software programs. More specifically, I heard from the Shirley Ryan lab in Chicago. They offer their software to families and patients. And so the ICAP programs tend to provide an overall greater intensity and number of hours of therapy in a very short, intensive time frame than patients would be getting treatment as an outpatient basis or with home therapy. So some of the barriers to attend programs for patients could be, many, and I think that's why many may not know about it or have barriers to be able to even attend. One of the first things is when patients end up initially having their stroke in the first year, there's so many medical complications and physical barriers that they have experienced. It's really hard to even think of going to an intensive program, and so they often don't search for these programs until later on. The other barrier are cost, because some of these programs can cost anywhere from $3,000 and even up to $26,000. So they can range and be very, very pricey. The travel is another one, because they often aren't in a location where family or patients live, and so the travel would be hard to figure out the accommodations while their loved ones are in the program. Some of the programs offer a stay included in the price. Some others you have to get your own accommodations separate from the cost of the program. So it's so important, I think, for patients to be able to attend, to have that social and family support, because those are the caregivers that are going to be bringing them to these programs. And lastly, we've seen this in a lot of our recovery after stroke, is depression and motivation to be able. Some patients feel like they just are not going to get better, and they have lacked hope, and so depression can set in, and they don't want to even participate in something that seems too intensive. So not much is known about ICAP programs or who may benefit, and so because not much is known, there's really no guarantee on a specific outcome. And so when families and patients are forced to make a decision whether to participate, there's this cost and travel and all of these other expenditures, and then really, what are we going to get out of this? That's the bottom line of what patients and families want to know. Is this going to help? Well, we don't really know. And there's several current research out there, but everything ranges. And so just as we've seen in post-acute care with our post-stroke follow-ups and in clinics, you know, things they range in a huge variety of designs, and so the program design may be different. The intensity of therapy could differ, and so some of these are 3 hours a day to 6 hours a day intensive therapy, and some programs only last 2 weeks and some last 6 weeks. So the range of therapy services for this intensive program may be different. There's also difference in components of the therapy of what they do during the program, and also there's many different variety of outcome measures that they've used to try to see if the therapy has worked or their program has worked, and so they use different measures. Some have used Boston naming tests and Western aphasia battery scores or comprehensive aphasia testing. So everything, the outcome measures that they utilize are different. And so since we see this wide variety of research out there, it's really hard to find out who's going to benefit, who's going to, and can I guarantee a specific outcome for a certain patient. And so it's really also not clear as to how long these programs should be. Should they be shorter in length with more intense therapy or longer in duration? But if we sit back and look at all of this together, we realize that this research is highlighting the lack of assessments and that we should be measuring and their impairments, and so who should participate. So I want to just throw one of the main research articles that I was focusing on, which summarized most of the current outcomes out there that we had from research about these programs. And it's from the Topics of Language Disorders by Babbitt et al. And it's titled, Who Benefits from an Intensive Comprehensive Aphasia Program? And it really analyzed some of these majority of these studies. And the only thing it really identified as a significant outcome was that age was a predictor of responders to therapy, and those were the younger patients. But there was really no significant difference in the months of onset of stroke, when to do it, the gender, the type of aphasia, the type of cognitive deficits that they have had along with aphasia or apraxia or any other significant differences. So it really calls for more research to examine this broader scope of variables that impact recovery in aphasia. So we've seen aphasia programs popping up all over the country now. I think they're becoming more and more well known. Here, we're going to be trying to compile several ICAP programs into a document so that we can share with, you can share these with your patients and families. And it may not be best to share them right away, because I know from my own personal standpoint as being a caregiver and caring for my mother-in-law and trying to find her modalities and ways to recover, it really wasn't until years 3 and 4 that I started looking more into these programs for her, when things settled down, when she was more stable medically. And I've actually found in my own personal experience with my mother-in-law's aphasia is that she's longer chronic aphasia. She's able to participate more in this program than she would have at year 1. And I think there's been a huge, rush to get patients therapy right away, and I don't think that's wrong. I think it's important to go, because we've seen some good outcomes with that, but also to not discount that later on in chronic aphasia, 4, 6, 8 years post-stroke or even longer, that they're not going to get better, and there's no therapy needs for them because they won't improve. Because I've seen the subtleties and improvement, and not just in her, but also talking with other program managers through these ICAP programs, that they have found there's been benefit to offering these ICAP programs to patients with chronic post-aphasia therapy than if they were going to go too soon. And so I wanted to get the word out there so that we can start thinking about it and start compiling lists for these patients that have nothing else and no hope and feel that there's nothing else for them. And so I also, last thing I wanted to discuss is, aside from ICAP programs, there may be a benefit for patients to be involved in some research because some of the types of research that they're doing seems to model some of the ICAP programs, and not fully, but it offers the patient's ability to maybe have some lodging and with the research program, so that the cost barrier is you know, decreased. And so there's a current study right now at USC involving a 10-month interval of intensive therapy, but they're also targeting specific brain damage that they're seeing on MRIs of these patients and seeing which type of therapy may be more beneficial for the type of damage that the certain type of aphasia patients have. So therapy, the research options are really good for, you know, the hope and continuing the recovery for some of these patients. It gives them more of an ability to find another program that may help. And these type of programs are throughout the, you know, the country as well. And so we'll also try to make a database for these patients and their caregivers, so that you may be able to refer these patients and just know what's out there. So I was going to answer any questions anybody might have. Thank you so much.